Well, hello. Welcome to Biological Psychology. This is Psychology 4403 for the undergraduate students and 6403 for the graduate students. My name is Dr. Michael Nadorff. I'm an assistant professor here at State, and you have my email there down below. I'll bring it up a couple times because really email is the best way to contact me. So if there's ever anything you need, just feel free to let me know via email. So our goals for today are to briefly introduce you to me, tell you a little bit about how I got here, what I know about biopsych, how I got teaching this class. We'll briefly discuss why biological psychology is important, and we'll review the syllabus and provide an overview for the class so you kind of know where we're going from here. So starting out with my academic lineage, I got my bachelor's degree from the University of Notre Dame, and I was actually a double major. I studied psychology and computer applications. And with that, I actually started out pre-med, but I quickly realized that, well, I loved the psychology aspect of it, and at the time I wanted to go into psychiatry, but I realized I didn't really love the chemistry part, and there were a lot of things I'd have to learn that I wasn't really passionate about. So I followed my passion and I switched to psychology. I did take a class like this at Notre Dame. We had a physiological psychology course that I took my junior year. It was actually not required there, but I wish it was. I took it because I wanted to be competitive for graduate school, and I thought it would help me with that. But what I learned is that these underlying processes are so important for understanding psychology and for being a competent clinician especially. So as you'll see, it's a class I was very glad that I took. I got my master's and my PhD from West Virginia University, and my training is in clinical psychology. So that's important. I'm not a biological psychologist by training. I'm a clinician. So that's kind of the viewpoint I take. That's kind of the way I see the world, is I look at clinical disorders and how we treat them. So a lot of my examples will probably be a bit more applied because of that. While at WVU, I took a fair amount of graduate coursework on biopsych, more than what is required. I took a course on biological psychology, and I also took a course on psychopharmacology. So that's the study of all the medications that affect your brain. I also had several clinical experiences that really helped teach me about biopsych as well. I worked at a insomnia clinic for 2 years, and with that, of course, there are a lot of disorders that can cause insomnia or are comorbid, meaning occur at the same time as insomnia. So I got a lot of exposure there. And actually, I was also working in that clinic within a primary care setting. So again, working in a medical setting, you pick up a lot of this stuff. I also worked in a psychiatric nursing home for a year, and again, gained a lot of information and knowledge about biology from that. My training's actually in geropsychology, so whenever you work with older adults, you learn a lot about biology because health, wellness, and psychology just fit so closely together for older adults. And lastly, I worked for a year in the bone marrow transplant unit at WVU. So this was working primarily with patients with leukemia. And in this experience, it really helped teach me the importance of having a strong foundation in biology to be a competent clinician. I'll bring up stories from time to time from this experience, but the one that stands out most to me is I was treating a gentleman who I had been told from the physicians had depression and needed depression treatment, and he kept not getting better, and we were trying everything, kept not getting better. And it turned out, unfortunately, that he actually had a tumor in his brain, and the tumor was right around the spot where, as we'll discuss, controls a lot of motivation. So he had no motivation, but it wasn't his fault. So with that, it's important to know those differences and to be trained on those because you'll want to be able to pick out the biology so you're able to treat your clients appropriately. Because sometimes you'll get a referral where even if a physician clears the person, it just won't work, or it'll feel like you're beating your head against the wall. And sometimes it's because it's not a psychological issue. So it's important to be able to untie those things as much as possible, given that we're not physicians, but still it's important to have that background. I did my clinical internship at Baylor College of Medicine in Houston, Texas, and I was on the geriatric mental health care and research rotation, or track, I should say. So, again, a lot of work with older adults, and my time was split between Baylor College of Medicine and also the Michael E. DeBakey VA Medical Center, which is the Veterans Hospital in Houston, Texas. So during this year, I worked a lot with older adults, but also learned a lot about biopsych and about medicine. I had a 6-week didactic series on psychopharmacology, so learned a lot about that. And we also had many lectures on biology and psychology and about how the two relate. So lastly, how to reach me. So my office is in Magruder Hall. It's on the first floor, but basically on the other side of the building than the psychology office. So if you find the psychology office in the front of the building, just walk toward the back and you'll run into us. You have my email here. Again, that's the best way to get in touch with me. Office hours, this is for fall 2013. So if it's not fall 2013 when you're watching this, just check on your syllabus and I'll tell you. I'll always update the syllabus on eCampus. But I try to keep it around this time. I like this time for office hours, but it just depends on the classes. So why is biopsych important? Well, as I mentioned, mental and physical health cannot always be separated. Actually, it rarely can be. And as I mentioned, I'll share with you more experiences from the cancer unit, especially where I saw that you can't separate these things. The physical, by its nature, is going to affect the mental. And with that, it's important to have a knowledge of both to realize what we can and can't treat, but also to understand how we can use our skills in psychology to help people dealing with medical problems. Another reason why this is important is roughly half of all applied psychologists work in medical environments, so you can't really avoid it. Well, you can, but it's hard. The VA, Veterans Hospitals, are the largest employer of psychologists in the U.S., and it's actually a really good place to work. So with that, if you had an aversion to hospitals, it's going to really limit you. Psychologists are also commonly being hired in primary care. This is a new development. This is especially for older adults because older adults will not go to see a mental health professional. They just won't. But they'll go to the primary care doc. So if you have a psychologist embedded in primary care, they can actually treat those people that wouldn't normally go and seek out mental health treatment. And lastly, sleep medicine, which is one of my areas of expertise, is a growing area. It's a great area. It's pioneered by psychologists, and it's growing exponentially. So it's another area that you could get into if you're interested. But again, you have a lot of biomics with the psychology. So it's important to have that foundation in biology. So in sum, it's difficult, if not impossible, in my opinion at least, to be a competent psychologist without a strong understanding of biological psychology. It's part of the reason why this class is required by APA for doctoral level people, and why it's required for us for our bachelors. It's really important to have this foundation. Also, many of the jobs that are in medical centers, or many of them are in medical centers rather, and knowing about biological psychology is essential for getting hired in these positions. You may be hired on a cancer unit. Well, you need to know a little bit about cancer and a little bit about biology and psychology if you're going to do your job well. So, introduction to the course. It's okay to be nervous if you are. It's a challenging course. I know you guys know that, but the good news is, while I have high expectations, I've set this class up as much as possible for you to succeed. I really have tried to stack the deck in your favor, as you'll see. You may not always like it, but know that virtually every decision I made in this class and forming this class has been how can I put you guys in a better position to succeed. So with that, the number one piece of advice I have to get through this class is to do the pre-course work. And you'll hear about this a little bit more coming up. But first, reading before the lecture, very important. But also, when I say lecture, I don't actually mean lecture in class, as you'll see. The lectures are going to be online. You're going to watch them like this video. So watch the lecture videos for each chapter before you come to class. Because in class we're going to be using a lot of the information from those lectures, but we won't be rehashing it because then there'd be no purpose in doing it. So watch the lectures online, then come to class, and then we'll apply it and help you learn it in a deeper way. Required materials. So first of all, the biological psychology textbook you'll see here. For fall 2013, you still can use the 6th edition, which you see on the left. After that, we're going to be all in the 7th edition. So fall 2013, you can use either edition of the book. I don't care. I will make it so that quiz questions apply to both versions. After fall 2013, then you need the 7th edition. That's the one in the middle. We also will use clickers a lot. So you'll need a clicker if you don't already have one, which looks like this thing on the right here. And we'll go into more detail in class about how to register those and how to use those and things like that. So this is a flipped course. You may have heard about that already. It's a different method of teaching. You may not have had it before. It's a new educational technique that's made popular by groups such as the Khan Academy. I don't know if you've heard about these, but they make a lot of really good, especially math videos, to help people learn math, algebra, and a lot of people have found it very helpful. So the thought here is that students watch the lectures online and they read the texts before they come to class. And class is reserved for question answer, active learning, discussion, things that have to be done in two-way methods of communication. Lecture by the way lecture is a one-way form of communication. I'm telling you something. Well, class is a great thing because you can do two-way interaction. So why are we wasting this two-way time, which is so valuable, for one-way interaction? So the thought here is put the one-way interaction, the lecture online, which is one-way, and then reserve the two-way time for two-way interaction. So there's been some research on this method. I wouldn't use it unless there's research on it. And what's been shown is that it's effective for classes where not everyone learns at the same rate of speed, and also classes where not everyone comes in with the same knowledge that other people have. In other words, classes just like this. And what's important is it's been shown to improve learning and improve grades. Both of those, grades as well. So with that, I know it's going to require a little bit more work for you. You're probably not used to watching your lectures at home. But again, know that this is one of those things that I'm doing to stack the deck in your favor. I really believe this is the best way to teach this material so that you'll be able to learn it. So just bear with me on it with watching the videos. I'm going to put them on YouTube, so that makes it a little easier because you can use your iPhone or Android or whatnot. So we'll make it work, but I think you'll see as we go on that you're going to learn better this way. That's at least what the research shows, and so I hope you'll come around to it as time goes on. I'm excited about it. I think it's going to really work out well for you, and I want you to succeed. No teacher wants people not to succeed in their class, so that's why we're doing this. So, weekly quizzes. This is another thing I do to stack the deck in your favor. I don't have tests. Um, well, except for the grad students, we'll get to that. Um, Weekly quizzes. So again, some of you will be like, why do I have to take a quiz every week? Well, it's to make it so there's a lot less material on each quiz. So you have to remember things for a much shorter period of time. So there will be 15 weekly quizzes, each one worth 50 points. I drop your lowest 3, so only 12 would count toward your grade. So how this happens is the quiz is actually open from Tuesday after class until the next Tuesday, and they close 30 minutes before the next Tuesday's class. However, I really encourage you, don't take the quiz until after Thursday's class, if at all possible, just so you have the benefit of going to both classes. Since you have basically a week to take each quiz, and there are 3 drops, I do not do makeup cert extensions. So just plan ahead with that. Usually it's not a problem because you have so much time. But just know that that's the policy. So don't put these off to the last second. Go ahead and do them as early as you can. So to give you an idea of how the scheduling works, so the quiz, let's pretend, since it is online, and I'm not sure when you'll see this, let's pretend that we are talking on January 8th, so the very first day. So the quiz for that day's material and Thursday's material would open after the class on Tuesday, January 8th, and it would be due at 9 a.m. In this case, that was 30 minutes before class started on January 15th. And then the next week, so starting the 15th of January, you can see for, here, let me use my pointer, that'll help you. So for this lecture and this lecture, these 2 lectures here, the quiz is due the 22nd, 30 minutes before class. So each week you're tested on the information, basically the 2 lectures before it. So if you have any questions on this, let me know. Usually this is pretty self-explanatory, but just in case, I don't want you to miss a quiz, so feel free to let me know if it doesn't make sense. You have 2 options of taking the quiz. Regardless, as we'll talk about in a little bit, you'll take the quiz using Respondus Lockdown browser. Now, and you can download this for free from Mississippi State. So you can take the quiz at home using Respondus. Books, notes, friends, etc. are not allowed. Honor code is in force. And you have roughly 45 seconds per question to complete the quiz. So you have, 20 minutes to do your quiz. This is usually the option people take. But let's say you just don't do well with time tests, or, for whatever reason, this doesn't appeal to you. Well, there's another option. You can also schedule an appointment with me to take the quiz in my lab using Respondus Lockdown browser. Again, you can't use books or anything like that. The main difference here is you have unlimited time. So anyone can do this. You don't have to have a disability or a letter. Anyone can do this. So if you want more time, if you feel rushed, just let me know. We'll make this happen. You'll take it in my lab. It's not a problem. Every now and again, my courses does funny things to quiz questions. Like sometimes percentages and apostrophes look very funny. You'll know it when you see it. If you encounter this, please email me as soon as you're done with the quiz. You don't need to remember what item, though that would be helpful. Just tell me something was funny on my quiz. I'll look into it, and if I think it negatively affected your grade, I'll give you credit for that item. So it can't hurt you, it can only help you. And it'll also allow me to correct it for your fellow students, so there's a win-win. Grading scale. So pretty straightforward for the undergraduate students. You have 12 quizzes worth 50 points each, so 600 points. So you see how this breaks down here with the points. Clicker questions. So we will have clicker questions every class meeting to ensure that you learn the material covered both in the text and in the online lectures. Now, what we do with these clickers depends. For the undergrads, so for 4403 students, the top students for a class period will earn 2 points of extra credit. So usually there, well, it depends. 8 or so students that do really well on these. So you get 2 points extra credit just for having paid attention, read the material, and watch the lecture before you come to class. That's not bad. You can do that every class. That adds up really quickly. For grad students, 6403, the clicker questions will count as part of your grade. However, with that, we do have some drops for you. So I promise you there'll be at least 120 clicker points possible, with 1 point per question. You'll be graded out of 100 points, so at least 20 points will be dropped, possibly more. So don't worry. There are points, if you have a bad day, there are points to make up for it, but you'll also be held more accountable for the information than the undergraduates, just because it is a graduate level course for you. Attendance for the undergraduates. If you have stellar attendance, so say maybe you never miss, or you miss maybe one lecture, not lecture, but class lecture, I may round your grade up to the next letter grade. This is completely up to me, but so I'm not promising this, but it's quite likely that that'll happen for you. For grad students, attendance is expected. Again, it's a grad class. So if you're going to be absent, please clear with me ahead of time, or contact me as soon as you're able. Final exam. For the undergraduates, 4403, no exam. Your grade is made up of your top 12 quizzes. For the grad students, you will have a comprehensive final exam that consists of questions from every chapter. So what will happen is I'll basically take the quiz banks from all the quizzes, put them into one big test at the end of the semester, and that'll be your final exam. So you'll likely have quiz questions that you've seen before. So that'll hopefully help you a little bit. So grad students, here's your grading scale. You have 12 questions, or 12 quizzes rather, worth 50 points each, so we're dropping the 3 for you too. 100 clicker question points, and 100 points for your final exam. So that's how it breaks down for you. So lectures, I do post my lectures. I post the slides on my courses, and those are to facilitate your studying, or if you want to take notes as you go along. If a concept is not covered by me in the video, or if you have a question about it, please ask me. It's your responsibility to ask me before you take the quiz. So don't suffer in silence. If you have a question, email me, get in touch, let me know how I can help. And again, if you have any questions, either ask me in class or email me. I really urge you not to call me. And the reason why is that my phone does not work, as far as it doesn't indicate when I have voicemails. So I try to check it a couple times a week, but it doesn't blink or beep or do anything when I have a voicemail. So sometimes out of sight, out of mind, I forget to check it. So if you have a question, email me. By far, it goes right to my cell phone. By far the best way to get in touch with me.